Okay, now we've had a look at the cellular responses, we're going to move on to have a look at the vascular responses. So really what we're looking at here is the microcirculatory system, which is the flow of blood through the microvasculature. So if we look over at this image over here, we can see we've got the arteries and the veins, which get smaller into the arterioles and the venules, so these smaller vessels, and then eventually it gets even smaller down to the capillaries and the capillary bed. And this is where the perfusion into the tissues occurs. So really when we're trying to influence blood flow, this is the region we're working in with these capillaries and the capillary beds. And what the microcirculatory system is responsible for is nourishing the tissues and the organs. So to bring blood to those areas, to perfuse into those areas, and to nourish those tissues with oxygen and nutrients. It's also responsible for removal of waste as well. And so this system regulates the blood flow in responses to the local metabolic requirements. So whatever's going on within the body, within the tissue, the demands will change, and in response to that, we will get a regulation of blood flow. So either more blood, less blood, whatever's needed. Now, obviously, in a dysfunctional patient, dysfunctional tissue, this isn't always working, and that's why we want to try to influence that to help the system along. Just one more thing to look at on this slide would be the endothelium here. So the endothelial lining, which is the lining of these vessels, that's where a lot of the action takes place. So we're going to look at 4 areas of microvascular responses. First one being vasomotion, which is something that BEMA talk about with their specific signal. So we'll go into a little bit more detail on that. You do have some resources for this lesson to accompany this lecture. And those resources do include a video from BEMA which goes into that in more detail. So I won't go on about that too long, but that is one of the 4 things that we're going to look at. We're also going to look at blood flow. And we're going to think about the Rouleau Formation, which is another interesting factor which can contribute to the actual flow of blood. Then we're going to briefly consider vascular tone, and this is mediated by endothelial nitric oxide synthase, which we will come on to discuss. And then finally, we will look at angiogenesis, which is the growth of new capillaries. So what we're considering is how can we get more blood to the area, and how can we get more blood to perfuse into the tissues to bring that beneficial oxygen or rather essential oxygen and nutrients for repair. So we're going to start by looking at vasomotion. Like I say, you do have a longer video on this coming up. So vasomotion is a phenomenon. It's in healthy patients. It's a naturally occurring phenomenon which is essential for blood flow, and there's lots of research on this. And this is taken from what BEMA quote, but like I say, there's lots of backup to this. So the healthy vasomotion occurs 3 to 5 times in a minute. In normal healthy patients, and in a dysfunctional patient this can be as low as 3 to 5 times in 5 to 10 minutes. So it really can really slow down. And what vasomotion is, you'll see many more examples of this, but it's a shunt. It's a shunt of the blood along the vessels, and it's like I say, a naturally occurring phenomenon. But when it slows down, when we've got problems, when we've got disease or any conditions, one of the underlying circulatory problems can be that this vasomotion slows down and becomes less efficient. And what BEMA say is that their specific frequency is in harmony with the natural frequency within us, and that frequency can then mimic the normal signals to to make vasomotion occur. So that's sort of the theory of how that happens. The work has been done by Professor Klopp from the Institute for Microcirculation in Berlin, and this video shows some quite impressive microscopic footage of this occurring. The work by Klopp, there are a few papers that are included as supplements to this lesson, and they'll also be in your vault, which is toward the end of the course where you have some reading time. So it might be interesting for you to read those and understand where this research comes from that BEMA relies on. So let me just show you this video because it is quite impressive. So just bear with me a moment while I get to the right starting point. Okay, so I'm just going to let this run and let you watch this. So you can see that collection there of red blood cells and that what looks like a sort of blockage and slowing down of the blood flow. So that's being caused by aggregation of red blood cells, which we'll go to look at in a moment in the next point of this. But you can see that after some treatment, it's quite a difference. BEMA also discussed the white blood cells as well, and you can see those on the right side of this video. You can see the white blood cells in the blood flow there. And you can see quite a lot more movement there. So these red blood cells through capillaries really need to travel freely, and they can stack together and aggregate, which is what was happening in the first part of this video, and that's something we're going to go on to look at. But you can see there that sort of collection of red blood cells is not what we want. So it's quite impressive, that footage, to show how that in the capillary levels we can speed up that blood flow. Okay, so yes, moving on then to Rouleau formation. And again, this is what I was just mentioning there when I was talking about stacking of the red blood cells. So what this is a phenomenon that happens, with disease, with a lack of circulatory health, if you like, and so what can happen is it's thought to be caused by fibrinogen in the plasma, an attraction between the red blood cells, attraction of electrical charges, and what happens is they aggregate and it's called stacking. So they stack together and clump together, and this reduces the blood flow and therefore the delivery of oxygen and nutrients. So we see this in cases of ischemic conditions and things like that. So this is where the capillaries, the peripheral capillaries are becoming clogged with this Rouleau formation, and it can be a problem, and it does reduce circulation quite significantly. So what PEMF does is it causes disaggregation and increased mobility of the red blood cells. So it recharges them, they repel each other. These are some of the theories behind this, and it just causes them to break up and move along. And there's a study which again is attached to this lesson, but will also be in your vault, by Lee et al. And what they showed was that this disaggregation, there was an optimum window of 10 minutes where the red blood cells, there was disaggregation of the red blood cells and a breakup of this Rouleau formation, increased mobility of the red blood cells. But with longer exposure, there seemed to be reaggregation. So it seems that the optimum window for this is around 10 minutes. And the effects of that, they also showed, lasted for about 2 hours. Okay, moving on now to vascular tone. So when we're thinking of vascular tone, we're thinking about vasodilation. So this is a key aim of physiotherapeutic intervention, which we all discuss and talk about with all of our treatments. So just thinking about it in an overview, when we are using any sort of therapeutic intervention, we are hoping to increase vasodilation, which will increase blood flow, which will bring with it oxygen and nutrients that are essential for repair and normal function. So if we can influence that vascular tone and improve or encourage vasodilation, then that is a benefit. And we know about nitric oxide. We've discussed that already, how it's a powerful vasodilator. So what PEMF does is actually modulates endothelial nitric oxide synthase. It modulates the activity of that. And what that enzyme does is generate nitric oxygen in the endothelium and give that signal for vasodilation. It's probably important to mention that this is a tightly regulated feedback loop. So in a similar way that we discuss, or I've discussed with you previously, when we think about inflammation, and how I prefer you to think about the modulation of inflammation rather than anti-inflammatory or pro-inflammatory, because it's such a sophisticated system, and the cascades are so sophisticated that it's not just a case of wanting to be anti-inflammatory. There are times, most of the times, we want to be pro-inflammatory to push through the healing process, but we don't want inflammation going on too long and in inappropriate situations, and therefore the body will modulate, or should modulate, the inflammation. So sometimes pro-inflammatory is what we want, and sometimes anti-inflammatory is what we want. Sometimes we want to ramp that up, sometimes we want to dampen that down, and the body modulates that. And by using electrophysical agents or the therapies that we use, we are aiming to help the body to modulate that. And it's the same with this. So it's not a case of applying PEMF is going to initiate a huge amount of nitric oxide release, which is going to be toxic to the body, or have any potential to be toxic to the body, because what we're doing is giving the body the capability to modulate these very sophisticated processes. And so enzymes will also be released to dampen down this nitric oxide release when there's ample amounts. So what the body does is initially use up all this good stuff, and then enzymes will modulate, dampening that back down and slowing it back down. And so that's where PEMF can help. It just gives the body, it gives the body the energy and the capacity again to release these enzymes, and then the body can then choose when they're appropriate. And then finally, we're just going to look at angiogenesis. So this is the same cascade that we've just looked at with vascular tone, and that same cascade actually enhances growth factor release, which is pro-angiogenic. So angiogenesis is the growth of new capillaries. So if you can imagine, if a tissue is not well perfused with capillaries, there's obviously going to be less blood getting there. And so again, this will happen in response to metabolic requirements. So if it is identified that there is not enough blood and not enough oxygen in a particular area, then the body will set about angiogenesis in order to grow new capillaries, and that happens in response to that requirement for oxygen. So you will sometimes see this discussed as neovascularization or capillarization. Angiogenesis is actually a type of capillarization. Angiogenesis is actually a type of neovascularization. There are other types. Capillarization is just another way of saying it, which is, this term is quite often used in exercise physiology when discussing oxygen requirement through fitting. If you're getting fitter, you're using your muscles more, there's a more demand for oxygen, and in response to that demand, new capillaries grow. And so angiogenesis can sometimes be thought of, or is often thought of, as a negative thing. And that is because if we have a tumour or we have some sort of diseased, growth, we don't, angiogenesis will occur in order to feed that tumour. And so pro-angiogenic can sometimes have a negative connotation because people will think of it as, we don't want that. But obviously, if we have a tumour, no, we don't want to feed that with fresh blood and encourage that to grow. But for healing, angiogenesis is absolutely essential because we want the tissue to heal, or we want proliferation of new cells, we want fresh blood and everything that comes with it. So it is actually a very positive thing, and it is essential for any sort of healing. And so if we can grow these new capillaries into the tissue, we can increase the delivery of blood and therefore perfusion. So they are just the 4 areas that we can look at when we're thinking about the vascular responses.